next special tests are to look at signs and symptoms of carpal tunnel syndrome. So the first one would be Phalen's test. And with Phalen's test, what you're going to have the patient do is go into flexion. So Phalen's and flexion, to me, kind of goes together. So what you'd have them do is put the dorsum of their hands together and hold in this position. So what you're doing is you're compressing the carpal tunnel here. And you'd have the patient hold that for a minute, or if they started getting symptoms in the median nerve distribution, numbness, tingling, shooting pain, thumb, index finger, middle finger, then you could stop the test. If they have no symptoms up to 1 minute, then the test would be considered normal or negative. If they start getting symptoms once they start the test or up to 1 minute, then the test would be positive. And then if the next test would be the reverse Phalens. So with the reverse Phalens, you have the patient now bring their palms together, kind of a praying position, and then now what you're doing again is you're putting a stress or provoking the carpal tunnel with the wrists in an extended position, and again you'd have them hold it up to 1 minute or until they get symptoms that are in the median nerve distribution, thumb, index finger, middle finger. Or if they hold up to a minute and they have no reproduction of symptoms or no symptoms at all, then the test would be considered normal. The next special test that we're going to look at is looking at de Quervain's, or first dorsal compartment tenosynovitis. So that would be the first dorsal compartment in this area right here, the abductor pollicis longus and extensor pollicis brevis. And this is the Finkelstein's test. So with the Finkelstein's test, you have the patient make a fist, but before they make the fist, they put their thumb down and make a fist around their thumb. This is a passive test, so now the examiner does the rest. So the examiner would stabilize at the forearm and then would passively, ulnarly deviate. A normal response would be no pain, no signs or symptoms in this area of the first dorsal compartment. A positive sign would be pain, once you start moving into ulnar deviation, or you may even feel a little bit of a crepitus or kind of a squeaking of that first dorsal compartment due to the tenosynovitis in that area.